So, welcome, dear friends. Here we have a special guest. And to be frank, I have not interviewed any student who has cracked rank 3 in INI and rank 1 in NEET SS. So, this is none other than Dr. Nikhil. Welcome, Dr. Nikhil, and tons of congratulations to you. How do you feel now?
Thank you, sir. Thank you so much. Yeah, sir, it's quite surprising. I wasn't expecting this. As
Yeah.
we know, I wasn't preparing much for this exam, so yeah, it came as a surprise.
So, you might be busy with the INI selection process, the counseling in right before the NEET exam, right?
Yes, sir.
And that is why you couldn't get much time to prepare for NEET as such.
Yes, and also because the results came out, I think 1 week before the NEET exams.
Correct.
So I think 1 week before the exam, the results came out. So after that, I didn't study anything. Just before that, I was kind of revising, but not that much. But that
Okay.
last 1 week, just closed my textbooks, nothing much.
Okay. So what was the target? Your personal favorite, was it INI or NEET?
I know it was definitely INI. I was preparing for INI itself.
Okay.
It was never in the picture for me. I just registered for it. But yeah,
Okay. And in between, you have cracked the MD exam also.
yes, sir.
Okay. And I am very much happy that you are my not only a Mara user but also my our own resident from Institute of Chest Disease, Calicut.
Yes, sir.
So let me ask you one thing. Let us straight away go to the main areas that we are planning to focus, so that it may be useful for the upcoming generations also for cracking the exam. So let me go directly. That how many questions are there for NEET SS?
So there are 150 questions. So it's
Okay.
like they have three sections in the exam: section A, B, and C. So each
Section
section
A,
has
B, and C. Okay.
C, and each section has
Okay.
50 questions each and 50 minutes.
Oh,
So it's
okay.
150 minutes and 150 questions.
And
So
on what basis are the? Yeah, continue.
so it's like the first section A. After you're done with section A, you cannot go back to the section. So it's like 50 minutes is
Oh,
done. That section is closed. So the next section
okay.
starts.
Okay.
And
Okay.
even if you're done with section A, you cannot go to section B unless those 50 minutes is over. So
Okay.
that's how the exam is set.
So there is no forward and there is no backward, basically.
Yeah.
And one more thing, on what basis are the section is it pertaining to one particular area? Is it like that, or is it just random division?
It was a mixed bunch only. I felt like two sections were easy and one section was very difficult. So I
Hmm.
think that's how they arranged. Otherwise, the questions, I think they're all mixed up. There was no
I mean,
particular pattern.
okay, then all the sections will have questions from all the areas.
All the areas, yes.
So basically, 1 minute for one question.
One question, yes. So
Okay.
the time
So,
is, I felt like it was a bit shorter than the INI because you
hmm.
have to be really focused answering the question. There are 150 questions, so you have to stay focused throughout those
Hmm.
150 questions. So yeah, that's a bit difficult.
I think the time is bit tight.
Yes,
1 minute for one question means.
yes, and there are some
Okay.
difficult
And
questions. You have
oh,
to get through the easy questions really fast if you want to
okay.
spend time on difficult questions.
Okay. So, second thing, how many questions from section A, B, and C were answered by you? Do you remember?
In total, I answered 146 questions.
Okay. Only four questions are left.
I think one section I answered all the questions. From the
Ah,
other sections, I think I missed out two each, if I can remember
okay.
correctly.
Okay. So the candidates should target at least above 140 questions as per your experience.
Yes, I think I talked to the other toppers as well. I think all of them answered more than 140,
More
almost
than
most of them.
140. So friends, that should be the target for you also when you are appearing for the NEET exam. So, how many options are there? Four options, right?
Four options.
So in the when you go through the question for the first time, some of you might be very much clear about certain questions, and some questions you might be in a 50-50 scenario, right? You are able to explore A and B, but you are confused between C and D. Did you go for that, having taken
Yes,
that chance?
yes, as I said, like in section A, I think the questions were very straightforward. They're very easy questions.
Okay.
Section B and C, there were a lot of difficult questions. I think NEET
Hmm.
SS was like, it's not like that, but NEET SS was more difficult from INSS. INSS was
Oh,
much more easier, I felt,
easier.
which is
Okay.
actually the opposite way usually. The previous
Correct.
years, usually INI is more difficult, but this time NEET was
Okay.
pretty difficult. I think every candidate found it difficult. So Like section B and C, you obviously had to guess many of the questions. Like I think I
Between
guessed
ah,
at least 20 to 30 questions. I wasn't sure, so I had to guess
oh,
the answers to those questions. Yeah. So
after eliminating two options.
even the scores are on the lower side for most of the candidates. So that tells that the question was difficult this time.
Okay, okay, okay. So if you get two options and you are eliminating two options, you will try your luck. You
Yes,
have
sir.
tried.
Yes, sir.
Okay.
Because
So
I
that's
knew I had a rank in INI, so I was willing to take the risk. There's nothing to lose for
okay,
me.
okay. That may not be applicable to all the candidates, but still
Yeah.
understand the point that he has taken that risk also. So when you compare the INI and NEET, you told that the NEET was much more tougher. And any other difference that you noticed regarding the time, etc., or the total pattern of the exam?
I think the pattern, as I said, sir, in INI there are only 80 questions. Here we have 150 questions. So that
Okay.
itself is a big difference. Like this is like you're going for a marathon. In
Yeah, yeah.
NEET test, you have to stay focused for 150 questions. I think that's the
Yeah.
major difference. And even
Mm.
the questions this time for NEET were very difficult. Like they went
Okay.
in depth into the guidelines, like some
Okay.
of the trials and drugs as well. So those are very
Oh,
difficult questions.
okay. So can you tell us, for the benefit of others, what are the major areas from which the questions were asked? Can you recollect?
So as I can remember, they touched all the topics. It's what I felt.
Okay.
Even from
Major topics.
TB, usually from TB, they don't ask many questions. I cannot remember the
Mm.
exact questions from even from
Yeah.
TB. There were some difficult questions this time. I
Okay.
think there were considerable number of questions from pulmonary hypertension, the drugs in
Okay.
pulmonary hypertension management.
Ah, ah.
Embolism, I think, is asked almost every year. All the exams,
Oh.
embolism is asked.
Mm, mm,
And drugs in ILD, they have touched everything.
mm.
So critical care,
Yeah.
ICU, the ventilator stuff, pneumothorax,
Okay.
they have touched on all the topics.
Okay. Any questions on recent advances?
Yes, as I said, like in pulmonary hypertension, the latest drugs, even in ILD, they have touched on
Okay.
all of that. Even
Okay.
in malignancy, they have touched on the treatment and follow up and everything.
Which one? Lung cancer.
Malignancy, yeah.
Ah, this
They were
targeted therapy, right? Ah,
yes,
okay.
and clinical scenario based questions were there.
Okay.
Many questions were there.
And any questions based on GINA Gold guidelines, NTP guidelines, bronchiectasis guidelines, guideline based, BTS guidelines?
Yes, sir. GINA Gold guidelines questions came from that. As I said, pulmonary
Okay.
hypertension, they gave a considerable weightage. I think not just
Mm.
the main guidelines, even some of the trials based on drugs were asked.
Okay. 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 So this was the same with INI also.
No, sir, INA was considerably easier. It was a much more easier
Okay.
paper. It was much more
So
direct.
okay. In 150 questions, how many were straight direct pointing questions, and how many were case based scenarios? Can you recollect?
I think most questions were case-based scenarios only. Like
Oh,
there was no, there were a few factual questions, and most of the questions were case-based only. Is what I
okay.
felt.
There
And
is no direct answers. Hmm.
straightforward, I would say there would be 100 to 110 questions were straightforward. I think the rest 40 questions were difficult anyway.
Okay.
That's for sure.
Which is based on a particular case scenario.
Case scenario as well as some random questions. Like for example, there
Okay.
was question on occupational lung disease. I think it was byssinosis. Some grading was asked. I never even heard of
Ah,
it.
ah, ah.
And that in Fishman also. So
Okay.
some random questions like that came on.
Hmm. Okay. So when did you actually start for preparing this? In your final year or in your second year? When should someone start preparing? That is the actual
Sir, like
thing that I would like to hear.
from exam point of view, I would say probably in the last 6 months maybe before my
Okay.
university exams.
Okay.
And before that, it's not like I was not studying. So, like even in first year, second year, I was reading the core topics. Maybe not
Hmm.
from an exam point of view, but in general, has to gain knowledge. And last 6 months, I think I really gave my 100%. I stayed focused both for the university as well as for the entrance exams.
And how is the preparation being different? For the university, you have to go in one particular way. For the NEET, you have to focus on a different way. Is it like that, or everything goes parallel and proportionate?
Everything goes parallel because I think the topics remain the same. I
Yeah.
think if you are preparing for entrance exam, then I think the depth of preparation matters. Like you'll have to go in
Oh.
depth into the preparation.
Mm.
University level, I think only superficial level of preparation is enough for writing answers in university exams. But if you're preparing for the entrance exams, then in-depth preparation is required.
Okay. So, does our Marrow classes help in some way for your MD as well as for your NEET or INA exams? The
Yes,
classes
sir.
which we have covered.
Last time, like it makes preparation much more easier. Like
Okay.
once you start with the Marrow classes, then your preparation becomes much more easy because then when you read textbooks like Fishman and Morinada, preparation becomes much more easier. And even if you read the guidelines, because whatever is given in the videos is basically a concise version of what's given in the textbook and the
Yeah.
guidelines. So I think, as I said, that's a starting point. The videos. Then obviously you have to go through the standard textbooks. Where I think reading Fishman has helped me a lot. All
Yeah.
the exams, it's the university or the entrance exam, reading Fishman gave me complete clarity on the topic. So for understanding Fishman, videos is important.
Okay. So do you listen to the class in Marrow first and then refer to the textbooks for the concerned section, or is it the reverse?
No, so I start with the videos. I think I started watching the videos towards the end of first year itself. So I'd watched
So
one or
towards
two
the
videos
first year onwards. Okay.
end of first year, I think.
Okay.
And like most of the topics I covered in first year itself, like watching the videos and preparing notes. And from second year, I think I started reading Fishman and
Textbook.
guidelines.
Okay.
Textbook, yeah.
So while you watch the video, you make your own note,
Yes,
concise notes,
that makes preparation much more easier.
which will help in revision also.
Yes, it makes it much more easier if you're writing in like in your own handwriting. That helps you recollect things much more better.
Correct. You can write it shortly also. And one thing I forgot, how many non-Palmo questions in NEET? For example, from statistics, from critical care, from cardiology, or from medicine?
I don't remember seeing any questions. I think it was core Palmo only.
Core Palmo only. And what about INI?
INI questions come from general medicine as well as statistics. I think that's if you're going for INI, then you definitely have to study statistics as well as medicine if you want a good rank.
Statistics and medicine. What about cardiology?
Cardiology, no, sir. Like there are questions on ECG, but I think that comes under medicine only.
Medicine only. And what about this thing, critical care? That will be included in both, right?
In both, sir. As I said, even mechanical ventilation questions came from that. So
any change in proportion, INI more critical questions, or is it the other way?
No, sir. I think even I think the previous years, I think a lot of questions on critical care came. So I think critical care is important.
And in NEET also.
NEET also is important, but in INI, I think critical care is not just the pulmonary side. I felt they can ask in general.
Okay.
Like there was a question of mesenteric ischemia in the INI exam, so that you can't expect it. NEET SS. NEET SS, the critical care will be along the pulmonary side only.
Okay. The pulmo aspect of critical care.
Yeah.
How many questions were there? Around 20 from critical care and NEET. How many questions in NEET from critical care?
Exact number I can't remember, sir, but I don't think 20 questions per. I think 10.
Less than 20, okay?
Less than 20.
10 to 20. So for INI, we have to have a broader approach, including medicine, critical care.
Sir, as I said, they asked questions from ECG. When as I said critical care, they asked about mesenteric ischemia. So, like, it's a broader aspect only. Like, you'll have to prepare in general. I think that is well covered in Marrow, the critical care classes.
Yeah.
I think that's really useful.
So, in that way, the NEET SS in Marrow may help because it may cover the entire thing that we discussed. Okay. And I forgot to ask one question. How many image-based questions are there in NEET as well as in INI?
In INI, as I said, like image-based, there were a lot of PhD reports in INI exam.
Which report?
Yes, in both PhD reports, like sleep study reports. There are a lot of questions in INI.
Okay. But any CT, radiology-based histology?
Not in INI, but in NEET, a lot of questions came from CT and X-rays. And those were difficult also. X-rays, I don't remember. Those were difficult questions. I didn't know the answers also.
Okay.
CT, I think, was straightforward. There was a question on sarcoidosis. They basically gave the CT and asked what is the treatment for this condition. So it was steroids only. There were questions like that.
So the images, radiology images are there in more in NEET.
NEET, yeah.
No histology image, right?
Histology, no, sir. I don't remember seeing
no PFT images. Okay. Okay.
PFT was there, I think. PFT was there.
Okay.
Yes.
Okay. So let us conclude. And what is your advice to the next generation? You are in a good position to advise them rather than anyone else right now.
So if you're doing a residency, I think focus on reading it. Like even if you're in first year, second year, don't just straight away go for entrance exam preparation. I think your residency is what's most important. I think your practice is
Correct.
most important. So like my first year and second year, I was learning to gain knowledge. It was not entrance or into preparation. It was only
Mm.
towards the end that I started learning from an entrance point of view. So I think first and second year, it's more about reading your textbooks, like watching videos, preparing your notes, reading the guidelines, so you can manage patients better. But obviously, in the final
Correct.
year, you have to focus on academics, your exams much more, your university as well as the entrance exams, and you have to decide like which exam you're focusing on. Like obviously, university will be covered, but whether it's INA or NEET, I think you'll have to decide that. Because if you're going
Mm.
for NEET, I think just focusing on one more alone is enough. But INA, you definitely have to prepare medicine as well as critical care in general. So
Mm.
that's even statistics. So that is required in INA.
Any other references that you resorted to for critical care and medicine for INI preparation? Any sources, resources?
No, critical care, 100% I use the Maro classes that's provided, and
No
even
other textbooks.
statistics, no the textbooks. I think it's well
Mm.
covered in even the Q banks.
Any statistics questions in INI? How many statistics?
I think 7 or 8 questions were there.
And what about in NEET?
NEET, I don't remember. So I don't know if I'm wrong, but
Okay.
I don't remember seeing any statistics questions in NEET.
Okay.
So yeah, so that's basically everything is covered in Maro only. Like even the statistics part, I just solved the MCQs. I wished
Okay.
I had prepared the theory part, but I had time only to prepare the MCQs from
Okay.
Maro on the statistics. But even that helped me sir the exam.
Okay. Any other advice for the students? So basically, what we learned from you is that you have a pace with your clinical postings, ward rounds in the first round, try to manage the patients, do your duties well, then start reading and focus on the classes. And when you reach a second half of the second year or by final year itself, start more focusing to the NEET as
Exams.
well as IELTS. That's a good advice, actually. So thank you, Dr. Nikhil, for your time and for the results. We, as a team, we are all proud of you. Thank you so much, and best of luck.
Thank you, sir. Thank you so much.